What do visual field defects reveal about the optic nerve? Imagine your vision as a detailed map of your surroundings. When parts of this map go dark or blurry, it tells us something about what's happening inside your. Visual field tests are like a way to check which parts of your map are missing or damaged. These tests help doctors understand how well your optic nerve is working because the nerve carries visual information from your eye to your brain. When the optic nerve is damaged, it often shows up as specific patterns of blind spots or defects in your visual field. These patterns are very telling. For example, if you have an arcuate scotoma, which looks like a curved blind spot, it usually means there's damage to nerve fibers that run along the curve in the optic nerve head. This kind of defect is common in glaucoma, a disease that gradually damages the optic nerve. On the other hand, if you notice a loss of vision in just one half of your visual field, it might suggest a problem higher up in the visual pathway, like a lesion in the optic chiasm or optic nerve. These defects often follow the anatomy of the nerve fibers, so their shape and location help doctors pinpoint where the damage is happening. In addition to functional testing, doctors look at the structure of the optic nerve head itself. Changes like thinning of the rim, notching, or an enlarged cup-to-disc ratio often go hand in hand with visual field defects. When these structural changes happen, they usually signal ongoing damage, especially in conditions like glaucoma. Monitoring both the visual field and the optic nerve head helps catch problems early and guides treatment. Different diseases cause different types of visual field defects. For example, in ischemic optic neuropathy, which is caused by poor blood flow, you might see altitudinal defects, where either the upper or lower half of your visual field is lost. In cases of compressive lesions, like tumors pressing on the optic nerve or chiasm, the pattern of loss can be more specific. Compression of the optic nerve itself often causes complete vision loss in one eye, while damage at the chiasm usually results in bitemporal hemianopia, where the outer halves of both visual fields are affected. In glaucoma, the damage usually starts in the midperipheral visual field with nasal steps or arcuate defects, and these tend to progress as the disease advances. Interestingly, in people with myopia, the shape of the optic nerve head can influence the pattern of visual field loss, making it more complex to interpret. Imaging techniques that look at the retinal nerve fiber layer complement visual field tests by revealing structural damage that might not yet cause noticeable vision loss. All these clues from visual field testing, combined with structural imaging of the optic nerve, give a full picture of what's happening inside your. They help doctors determine if the damage is due to glaucoma, a tumor, or other nerve problems. Recognizing these patterns early is crucial because it allows for timely treatment to prevent further vision loss. Remember, everyone's eye is unique, so if you notice any changes in your vision, it's always best to consult an eye care professional. They can interpret these tests accurately and guide you on the best course of action based on your individual situation.